Hello everyone, this is Dr. Lata, your consultant obstetrician gynecologist here at Ankura Hospital, KPHB. Today let's discuss about rather a common topic, which is backache in pregnancy. Most of you would have had backache during your pregnancy at some point of time, isn't it? Unfortunately, some of you might have had back pain right from the beginning of your pregnancy. What exactly causes this back pain? Though there can be a number of reasons, they can broadly categorized as those that do have an underlying reason and those which do not. Now, looking at the causes for those which do not have an underlying pathological reason, number one could be the weight gain in pregnancy itself, which causes additional strain on the spine and hence the backache. Number two could be the hormones released during pregnancy that acts on the ligaments supporting the uterus and hence may result in a backache. Number three, which is very important, is the postural changes that normally do happen in pregnancy and the faulty coping up mechanisms with many women, which may lead to a backache in a lot of them. Now, on the other hand, if we look at the causes which do have an underlying pathology, number one could be the concerning factor in the pregnancy in itself. For instance, it could be a part of the symptom that may indicate a miscarriage, which has to be sought immediately. The other reasons could be any urinary infections. The other one could be just the constipation that commonly occurs during pregnancy that may result in a dull aching back pain. Now, at this point, you might be wondering if it's actually serious to have a back pain in pregnancy. The answer is no, not most of the times. However, it's always a good idea to consult with your doctor regarding any minor concern or issue that you may have during your pregnancy and seek necessary medical help. Now, on the other hand, there could be some red flag signs, meaning signs and symptoms which need immediate medical help and attention, and some of them could be back pain that's associated with abdominal pain or abdominal tightenings, back pain that can be associated with any vaginal discharge, be it a clear vaginal discharge or a blood-stained vaginal discharge. The other one could be a back pain that could be associated with high-grade fever and chills associated with any urinary symptoms. So these are the situations when you should seek urgent medical help. Having said all these, is there any remedy or is there any tips and tricks to tackle with such back pain in pregnancy? As we discussed, ruling out the serious conditions, there are certain ways to help combat these situations or back pain during pregnancy. Number one is to adopt a good posture. Adopting a good posture is very, very important. For instance, when you stand straight and tall, distribute your weight equally on both legs. If you're someone who happen to sit for longer duration of time, be it as part of your routine or as per your work demand, then make sure you select the right chair with appropriate lumbar support preferably. You may use a small pillow for additional support to your back. And the other most important thing is to take very frequent breaks in between. Needless to say, avoid high heel footwear. Rather, choose a low heel footwear with appropriate arch support. The other things that might be helpful can be lifestyle changes, as in mild exercises such as a casual walk, or swimming might really help as it has many added benefits as well. So the other ones can be usage of any ointments and topical sprays as in for any external application in case of back pain, of course after discussing with your doctor. Hope all this might help during your pregnancy, and of course I'd like to emphasize that if you suffer with backache in pregnancy or for any other reason, do not self-medicate and do not seek any over-the-counter medication, because whatever you take may pass on to your baby and cause hazards to your unborn baby. So stay safe, have a healthy and a happy pregnancy. Thank you.